The popular saying, health is wealth, no doubt explains the priority position that the health sector occupies in the society. Although health is such a critical facet of the economy, the Nigeria health sector has continued to struggle with serious challenges, including poor funding, incessant strikes, and massive brain drain among medical practitioners. According to the Nigeria Medical Association, about 75,000 medical doctors were registered by the Medical and Dental Council of Nigeria as of 2020, but over 33,000 of this number have migrated for greener pastures. We spoke to some medical practitioners about the huge migration of doctors from the country and what that portends for an already weak healthcare system.
It's no longer a challenge. It's a very huge problem. Very huge. In the sense that previously, like in the 80s and other times, it was the senior doctors that were leaving the country. But the trend now is that both the old and the new. In the last few weeks, we've had 4 senior consultants leaving this establishment for greener pastures. The number of the younger ones, I can't keep count. They are just enormous.
Brain drain is as a result of majorly 2 things. One is remuneration and better pay for work being done. And another one, and the other option is satisfaction, job satisfaction. There are ways we can turn this trend around, not just having to pay lip service to the health system. The health system really there need to be a huge investment in the health system. And the huge investment has to be on the human resource for health as well as the infrastructure.
Although doctors have often cited poor welfare and remuneration as reasons for the massive brain drain, the Minister of Labour and Employment on our political program Politics Today insists that the government is investing more in doctors' training than any other country in the world and wants them to show some gratitude. He also disputes the figure of the number of doctors who have left the country.
The statistics you are reading out is wrong. It's wrong. Over here, they only talk about health in terms of what you give to hospitals. How about what you spend on water and sanitation? It's part of health. The people who are talking about those who are going for greener pastures, how many medical doctors in residency training in America ask government to pay them residency training fund? How many? In the United States, you pay to enter the residency program. In the UK, the same. You are paying. Here, we pay them in training, salaries and allowances, and also give them money for examination, for books, for transport, to exams.
Resident doctors, who are also called doctors in training, represent about 25% of doctors in Nigeria, hence the impact of their strike is often felt whenever they withdraw their services, as it is the case currently. The last 1 week of a renewed strike by the resident doctors have visited untold hardship on patients in public hospitals. An already overburdened system with a ratio of 4 doctors to 10,000 patients is now further complicated with the withdrawal of services by an estimated 16,000 resident doctors nationwide. The situation is perhaps even more dire given that the current situation is happening amid a fear of a 3rd wave of COVID-19 in the country.